So who's a good candidate for this procedure? Really, anyone who has an inguinal hernia who does not want to use permanent or synthetic mesh should consider this procedure. The risk of recurrence in tissue repairs has been, in studies that are very, very long-term, been found to be about 1% higher than the use of permanent synthetic mesh. But these percentages are very, very low, as in like 1 to 2% to maybe then 2 to 3%. So again, the numbers are quite low as far as recurrence. I always tell patients, admittedly, hernia recurrence rates are very, very difficult to track long-term. Many surgeons will tout that they've never had a recurrence. In those situations, the difficult thing is the patient doesn't always follow up with the same surgeon who may have even done that repair. If you do surgery on someone and they move to a different state, for example, and 5 years, 10 years, 20 years later, they have a recurrence, or even 1 year later for that matter, many times the patients do not contact the surgeon and say, oh, by the way, I'm in a different state, but I had a recurrence and I'm having it taken care of somewhere else. So that's one of the difficult things that's really kind of hard to follow long term and fully admit that that data and those studies are to some degree flawed in that way.